In this video, we're talking about bacterial urinary tract infections in cats. These infections are common in older cats, especially older female cats. They are also quite common in certain groups of cats with underlying conditions, and we will talk about these later. Bacterial urinary tract infections are extremely uncommon in young healthy cats, but young healthy cats can develop cystitis, which is inflammation of the bladder, and this is completely different to a bacterial urinary tract infection, but the symptoms are similar, so the two are often confused. And later we will discuss how to tell the difference between cystitis and a bacterial urinary tract infection. Let's start with what a bacterial urinary tract infection is. Essentially, this is an infection in the bladder. Bacteria will multiply in the urine or on the bladder wall and cause inflammation and irritation of the bladder wall. This is usually an ascending infection, so the bacteria come from the perianal region. They travel from the outside to reach the bladder through the urethra. The urethra is the tube that carries urine from the bladder outwards. Cats with bacterial urinary tract infections often have no symptoms. In cats who do have symptoms, a bacterial infection is detected in the bladder because the cat will start to urinate in the house in places that they would not normally urinate, such as on beds or on carpets. These are usually normal size wheeze, although sometimes your cat will have trouble passing urine, so sometimes the wheeze may be small. And you may also see that your cat strains to urinate and the urine may smell unpleasant. Occasionally, cats feel unwell with an infection in the bladder, but quite often they do not, so they still eat and drink as before, but their urination is different. Just like in humans, female cats are much more susceptible to urinary tract infections compared to male cats because of the length of the urethra. Diagnosing a urinary tract infection in cats is relatively easy. A sample of urine can be taken directly from the bladder. We can look down the microscope to see if there are any bacteria present or any other signs of infection. And if we do see bacteria, it can be cultured to see which bacteria grows. If your cat does have a urinary tract infection, your vet will prescribe antibiotics that will kill those particular bacteria. Taking urine from the bladder is straightforward in most cats, and it can be done during the consult. Sometimes your cat may need to stay at the vet for a few hours if their bladder is too small to get a sample, or if they are overweight and the bladder is difficult to feel. In these overweight cats, ultrasound may be needed to help to guide the needle into the bladder to get a sample. Most cats do not require any form of sedation for this process of taking urine from the bladder, which is called cystocentesis. Let's talk about which cats are prone to urinary tract infections. Bacteria can only grow in urine that is dilute, so any cat with kidney disease is at risk of developing an infection in their bladder, especially female cats. Other conditions, such as an uncontrolled overactive thyroid, can also cause you to have more dilute urine, so these cats are also at risk. Bacterial urinary tract infections are also very common in diabetic cats, especially if their diabetes is not well controlled. Diabetes causes the urine to be more dilute, which allows bacteria to grow in the urine. With diabetes, there is often glucose in the urine too, which bacteria love, and it helps them thrive. Urinary tract infections do happen in male cats, but this occurs much less commonly than in female cats. But male cats who have had surgery to shorten their urethra, a surgery called a perineal urethrostomy, are also susceptible. Let's spend a few moments talking about cystitis in cats, because people often confuse cystitis with a urinary tract infection, and this is completely understandable as they can look exactly the same. Cystitis is inflammation of the bladder wall, but it is not due to bacteria. Cystitis is inflammation without infection, whereas a bacterial urinary tract infection is inflammation of the bladder wall with the involvement of bacteria. Cystitis usually happens when the urine concentration is really high. It is normal for cats to have a very concentrated urine, but this concentration drops as they age, often due to kidney disease. Bacteria cannot live in the very concentrated urine of young cats and cats who have concentrated urine, so bacterial infections in the bladders of young healthy cats is very uncommon. But the concentration of urine can contribute to cystitis in these young cats, because this acidic concentrated urine can irritate the bladder wall. So cystitis is very common in young cats, but it can also occur in older cats and even in cats without concentrated urine, as many other factors can contribute to developing cystitis, such as stress. If you want to learn more about cystitis, please watch the video that I've made about cystitis on my website. Because both bacterial urinary tract infections and cystitis involve inflammation of the bladder wall, the symptoms that the cat displays can look exactly alike. Age, history, and any underlying condition of the cat usually help us to guess if we are dealing with infection or cystitis if we cannot get a urine sample. Treatment for bacterial urinary tract infections generally involves antibiotics. The choice of antibiotic will depend on which bacteria have grown from your cat's urine sample, if your vet was able to get one. Pain relief anti-inflammatories may also be needed for a couple of days to make your cat more comfortable. And if your cat is diabetic and has developed a bacterial urinary tract infection, your vet may also want to consider if your cat requires more insulin to treat their diabetes. I mentioned in the beginning that some cats do not show any signs of infection. This is true of many cats, and it is in typical cat style. Cats so often suffer in silence. That is why all older cats, especially female cats, should have regular urine screenings performed to make sure that they are not hiding an infection. All diabetic cats should also be screened regularly, especially female cats. Those are the most important things that you need to know about bacterial urinary tract infections in cats. If you have an older cat or a cat with kidney disease or diabetes, this is something that you should monitor them for, especially if you have a female cat. I have more resources on my website, allcats.co.uk, and if you have topics that you would like to see a video on, please let me know and I will be happy to make one for you. See you in the next video.